Both of Rhode Island's field hospitals have begun accepting patients as the number of hospitalizations breaks records. Good evening, I'm Mike Montecalvo.
And I'm Shannon Heggie. Tonight there are 410 people hospitalized, which is the most in Rhode Island since the pandemic began.
These numbers include 41 people in ICU and 23 on ventilators. 7 more people have passed away after contracting the coronavirus.
The Department of Health has also announced 1,043 new cases, which equals out to a daily positivity rate of 9.5%.
Rhode Island is testing over 10,000 people a day and finding nearly 10% of them have the virus.
Those numbers causing both field hospitals to open up. The Rhode Island Convention Center took its first patient today. 12
News reporter Brandon Truitt is live in front of that field hospital with a look at the operation currently underway. Brandon?
Well, Mike and Shannon, I got to tell you, I've been covering stories here at the Convention Center really throughout this pandemic, and I have not seen it as busy as it was today. You have testing that is still happening here, a field hospital that is opened now as well, and there were national news outlets here today, too.
This is really unprecedented.
A look at the state of the pandemic in Rhode Island through the resources needed to keep up with demand. Both field hospitals in the state are now live. COVID beds in Rhode Island are full.
It's not a place where anybody wanted to be.
On Tuesday, Lifespan brought its first patients to the Convention Center, just a day after Care New England did the same at their site in Cranston. Lifespan estimates roughly 24 patients will be here by the end of the day. Care New England expects about that number by the end of the week there.
Our existing staff have taken on extra shifts. They have been willing to float to different units to really provide care and service.
Both field hospitals sounded the alarm early that staffing would be a problem. Lifespan says they have seen retired medical professionals answer the call and step up back into work. They've brought in short-term staffing too.
They come in from all over the country.
Helping hands that haven't stopped working, with doctors begging people to tighten up.
Follow the instructions given by the governor, and it's very simple.
Testing is going to continue to happen here. It is a totally different system compared to the hospital setup here. The National Guard tells me that their daily testing capacity is not going to be impacted by this field hospital. Live in Providence, Brandon Truitt, 12 News.
Rhode Island now has 2 active field hospitals. The Rhode Island Convention Center took in its first patients this morning. 12 News reporter Brandon Truitt was first to report the activation of the Convention Center Field Hospital this morning. And Brandon, what else are you learning tonight?
Well, Shannon, it is Lifespan COVID positive patients who are going to be brought here. They're going to be brought around the back of the Convention Center near a loading dock there. There are 600 beds set up inside, and Lifespan expects roughly 24 of them to be filled up by tonight.
This is an option once we have run out of every other option, and it absolutely is something that we can avoid.
That was the warning more than 2 weeks ago, but here we are. Both field hospitals in Rhode Island now have patients inside.
I've never seen anything like this before.
The Cranston Field Hospital saw its first Care New England patients Monday. Just a day later, the Rhode Island Convention Center activated too.
It's not a place where anybody wanted to be, but you know, it's not unique to Rhode Island.
Dr. Salim Sooner is one of the minds heading the hospital at the Convention Center. With beds filed in place, staff at the ready, it's a sight he's not seen in years.
This is really unprecedented. I mean, I was in New York City after 9/11, and we set up field hospitals around Ground Zero to take care of patients. I responded to Katrina in New Orleans and Mississippi.
The difference, he says, the scale of this operation, it's as big as the threat of the virus itself. They've sorted through logistical challenges, including staffing shortages, Lifespan bringing in extra hands.
The types of individuals who do this kind of agency, short-term staffing work, they come in from all over the country.
These frontline workers haven't caught a break.
This is a marathon. We've been running this marathon since March, and it has not really stopped.
And Dr. Sooner is reminding people that the actions taken out here directly impact what is happening in there. It's worth noting that the National Guard says the testing that is done here at the Convention Center is a totally separate system. It will not be impacted by this field hospital. Live in Providence, Brandon Truitt, 12 News.